Good day, everyone. My name's Professor Neil Piller. I'm Director of the Lymphedema Clinical Research Unit at Flinders University in the Centre for Innovation in Cancer. It's sad that I can't be with you today in this exciting day for you, learning about all aspects of the lymphatic system, lymphedema, diagnosis, treatment and management. I'm going to talk about the basics of it, just so that when you go into all these other sessions today, you've got a good basic understanding. If you haven't had a chance, please read my abstract now. That'll give you a good feeling of the context of this talk today. So here we go. Why should we have to pay attention to the lymphatic system? Well, it's really important that we do, because the lymphatics are a sewer. It's got to flow, and you know what the sewage system does. Now, I know I've spoken about this lots and lots of times before, but it's important that it works. Good lymph flow is needed for our cell and tissue health. So all the things that make up our body to function well have to have good lymphatic system flow. And one of the negatives about the lymphatic system when it's not working is that when lymph flow is slow, more fat deposits wherever that lymph flow is slow. And of course, if lymph flow is not all that good, it means that we're at a higher risk of infection, as you see here in this picture. And the other most important thing is our immune responses are poor when our lymph flow is poor. So that means we can't react readily and quickly to infection and respond quickly. Now, here is this complicated picture, and you know, this is where it's all at, and this is where our treatment, this is where what we do is going to make a difference. And looking here, see where I've got my laser pointer at the moment? That's the arterial side of the system. That's an arteriole. See the muscle elements in its wall. And then what happens, it comes across this area where I'm now moving, and this is the capillary bed, sometimes called a capillary loop. Here's the arterial side of the capillary loop, and here's the venular side, the venous side of the capillary loop. And here we go now, looking where my laser pointer is traveling, to the venule, the drainage part. So this is our vascular system, and in white here in the background you can see our lymphatic system, but you can see here in this area they're all in close proximity. This is where everything we're talking about is going to be happening, and where we can make a big difference at this level. It's the cellular and tissue level. Now, one thing we know about our lymphatic system is that it's a very much holistic system. And what we have to do is make sure that we are dealing with the whole system all at once, okay? In other words, we must think, we must assess, and we must act holistically. Because everything that drains out of our blood vessels here in the feet, say, have to go through our knees, through our groin, through our tummy, through our chest, to our left shoulder. It's a long pathway. So this is why we have to be holistic. Of course, that pathway is not quite as long as from the legs when we're talking about the arm or the head, or in fact the right side of the body, but it's still a long pathway, and we have to think holistically. Now, why this big picture? Why is it important? Well, my key message that I've always used is that we have to empty the buckets first. You can't put water in a bucket that's already full of water. Or if I've got a bucket full of rubbish, I can't put any more rubbish in it until it's emptied. So that's really important. We have to have somewhere for the lymph with all the things in it to go if it's going to work well. So that means we have to create a space for the lymph and its contents to flow into. And you know, it's what many of our therapies attempt to do, and you'll learn about that for the rest of the day. But most importantly for you, it's what you, your partner, and your carer can do. And I want you to never forget that. You've got a big, strong leverage point here in terms of doing this, clearing the lymphatic system. The general parts of the lymphatic system are quite simple. They're lymphatic territories. That's like the states in Canada. And they're sometimes called lymphotomes. And each of these lymphatic territories is separated by a boundary. That's a state border, and it's called a watershed. And this is what they look like. You can see here an approximation of those. These are stylized pictures. Neither you nor I nor anyone else in the room today listening to this has got territories exactly the same as these. But nevertheless, they give us an idea about different parts of the lymphatic system, at least on the surface. And we see here where my arrow is pointing at the moment, you see this one here, that's a medial territory. There are 3 lymphatic territories in the upper arm. And sometimes this one here where my arrow is at the moment, I'll just put on the laser pointer for you, where my laser pointer is at the moment is the one most commonly with the problem initially. Likewise, here's one here. It's the medial lymphatic territory of the leg. And this one most often has problems, first of all, and shows signs of problems. So basically, coming back to this, there's about 6 lymphatic territories in our arm, 3 in the upper arm, 3 in the lower arm, and 4 in our legs. There's a little fella here. See where my laser pointer is? There's a little fella there, just behind in the calf area, which also is involved. Okay, so let's now move on. You've understood those territories. And you see here, this is the complexity. This is the reality of them. It's not as simple as those diagrams previously showed. It's quite a complicated system, and these pathways can be different in all of us. But just think about that. But nevertheless, despite this complexity, we can still make a difference. Now, let's have a look at the organization of the lymphatic system. One of the most important things to recognize is that most of our lymphatic problems, our lymphedema, close to the surface of the body. In other words, above our muscles. You know, I'm not saying that there's no problems below the muscles, but the place where they show themselves most often is above the muscles. And see here where I've got my laser pointer, that's the covering over our musculature. It's called a deep fascia. And look here, this is where most of our larger lymphatic collectors are called. Okay, there they are, just lying sometimes above this deep fascia and sometimes embedded within it. But one thing else I want you to look at is look at this little fella here. This is a connector between one of our lymphatic collectors and another called an anastomosis. And it's important. That's what surgeons sometimes try and link up this vessel with that vessel via another anastomosis. That's what a therapist will try and do, is open up this pathway and help lymph flow through it if this one here where my laser pointer is now is blocked up. So it's important to understand that. And up here, of course, is our skin. So you've got a good feeling of that. Now, let's just have a look at the functioning of the lymphatic system. Okay, what we have to do is get the fluid and all the waste products that are sitting in our tissue into these lymphatics. See, now we're going down. You'll see another picture of this in a minute. And once we go down deep into the tissues, the lymphatics start taking care of that fluid load themselves. They've got muscles in their walls. They've got pumps, and they'll pump that fluid and that waste product out to our lymph nodes. But look over here. This is a big issue. This is the white area, at least, that you can see of the supporting fibers. But look here, sometimes there's too many supporting fibers. And what this means is our lymphatic vessels, that you see one here, can't open and close. It can't move, it can't function, and it can't carry away the waste products. So I'm just making a statement here that fiber is probably one of the worst enemies of our lymphatic system in terms of its functionality. Now, you saw on the last diagram a little bit about the functioning of the lymphatic system, but here it is again. You see here, as we move our muscles or we move our tissues, fluid goes into the lymphatic system, goes down deeper into the system, and as we go down deeper, we've got, you see here where my pointer is at the moment, you see here now the lymph vessels pulsating. That's a lymphangion, it's pulsating. And it's pushing whatever's been loaded into it along our lymphatic collectors just above the deep fascia to our lymph node. So what we've got to do, a key message here, is we've got to help the fluids and their contents get into and then along our lymphatic system to help it work as good as we can. Okay, just remember that again. Super, super important. Now, let's have a look at the factors which determine our load on our lymphatic system, because every time you see one of these, it's a leverage point for you. Well, number one is capillary pressure. Okay, capillary pressure is the pressure in the capillaries. It's determined by your blood pressure and other things. Capillary permeability is also important. That's the leakiness of your capillaries. You know, have you noticed when you get older, we bruise a little bit easier? That's because our capillaries are a little bit more fragile. And sometimes in some of us, that fragility becomes a serious problem, and we may have to look at stabilizing those capillaries, making them stronger. It's a particular issue in those people with lymphedema, as we may see later. The other thing which determines the load on our lymphatic system is tissue protein. They're the big molecules that are sitting around in the tissues, and these attract water. For instance, one protein molecule can attract about 1.5 million or 2 million water molecules. So if we can get those proteins to go out of our tissues and not sit around via the lymphatics, we can take away the water. It's not going to hang around in the tissues. The next one is the number of active capillaries. The more we move and do things, the more blood supply our tissues need, and the higher the proportion of active capillaries. So, you know, but activity is good, but it does impact on the lymph load. And the other one is the fat types in your diet. And you may see more about that today or tomorrow. And fat types basically means there are lots of different types of fats. There are ones called long-chain triglycerides, and they're the ones that sometimes can load the lymphatic system unnecessarily and cause some problems. But someone else may talk about that in detail later for you. Now, let's have a look at factors which determine lymph flow. Remember, what we're looking at before was lymph load. Your blood pressure can add to lymph load, etc. But our lymph load can increase lymph flow if the lymphatic system is working. The other thing which can also help lymph flow is how frequently our lymphatics are pulsating. You saw in those pictures the lymphatic vessels pulsating about 6 times per minute. The other thing that helps lymph flow is activity in our muscles. The more we move, the more that lymph is pumped out of our tissues into the lymphatics. The other thing that's really important, I'm sitting here right now not breathing as well as I should be. Every time we have a big breath in and a big breath out, that can vary the pressure in our chest and in our tummy, and that can help lymph flow from those two areas, and can help lymph flow from our legs and from our arms. The other thing that's important is lymph flow is determined by the pressures exerted by surrounding structures. Even when I'm sitting on a chair, there's pressure on my lymphatics on the back of my leg. If I've got a bra on, well, I'm not wearing a bra, of course, but if I had one, or if I had tight underwear on, that may have an influence on my lymphatic drainage. So fairly important to remember. What we're wearing may have an influence. And also the pressure applied by compression. Really important. That's one of the bases of our treatment, is compression. That helps reduce the outflow from our blood vessels and helps pump the fluids out of the tissues when we're moving and when we've got a good pressure gradient. More about that later from others you'll hear. Let's now just have a look at our lymphatic system again. I want to emphasize, number one, it's low pressure. Its pressures in there might be 1 or 2 or 5 or 10, maybe up to 40 millimeters of mercury. Not low blood pressure, which, you know, in myself today, it's probably up around 135/80. You know, it may be a little bit lower, it may be higher, depending, but it's low pressure. That's the lymphatic system. Remember that, low pressure system. It's small volume. It's only around about 2 to 4 liters per day that drains into this area up here near our left shoulder. Why is it big? Why is the big variability? Well, the variable comes from the lymph flow from our tummy area and associated with the foods we eat. What I want to also emphasize, the lymphatic system is slow flow and slow acting, not like our vascular system. And of course, if the lymphatic system is not working 100%, it could be slower and slower in its action, which means infections can proliferate. But remember, the lymphatic system is absolutely essential for our optimum immune response. If I've got bacteria in my fingers here, the immune system has to respond to those bacteria and send out our defense system to my fingers later on and control that bacteria, destroy those bacteria. And it's also, the lymphatic system is essential, therefore, for our cellular and tissue health. Super important. 2 things to always remember. Now, I just emphasized before that lymphedema for most of us is a superficial problem occurring above the deep fascia. You see here a normal limb, you've got your bone and you've got your muscle, and here it is here, bone and muscle, but the compartment above that is called the epifascial compartment, and that's where the lymphedema, that's where the fluid accumulates, that's where the fat can accumulate and where the fiber can accumulate. That's what a lymphedema limb looks like. Remember, it's superficial mostly, and that's makes it in a way easy for us to manage because it's superficial, but sometimes it does create difficulties for us, as we'll see later on. Now, the basis of lymphodemas, there are all sorts of different types. You'll come across them today. There's primary lymphodemas and there's secondary lymphodemas. Those associated with surgery, those associated with radiotherapy, and those associated with tumor. Okay, now in Canada and Australia and most of our developed countries in the world, we don't have parasitic problems, filarial lymphodemas, but in countries like India and Southeast Asia, there are many cases of filarial elephantiasis still. So that's also a secondary form. But what I want you to remember, irrespective of whether it's primary or secondary lymphedema, what we've got is a reduction in lymphatic transport. Our lymphatic system's not working as well as it should be working. Really, really important to remember. And I also want you to remember that you may have an underlying primary lymphatic problem underlying a secondary lymphedema. Super important to remember that also. And here's just a very simple diagram about lymphedema. And it explains why not everyone gets lymphedema as well. You know that maybe about 17 or 18% of people who have lymph nodes taken out of their armpit, a lot of lymph nodes taken out, will develop lymphedema. The rest of them don't get any problems. Why? And the answer is because when we've had our lymphatic system damaged or destroyed or removed, our lymph nodes removed because of necessary cancer treatment, if our lymphatic transport capacity, which is this blue area here, is above our lymphatic load, which is the yellow area, you're not going to have any problems. In other words, it's a bit like having spare seats on the train, or a bit like having spare seats on the bus. If there's spare seats, more people can get on and be taken to where they need to go. The same happens to the lymphatic system. If the transport capacity is greater than load, no problems at all, no swelling, no lymphedema, but we still must be careful. However, when the lymphatic load, as you see in this yellow area, becomes greater than transport, that's where we get swelling. And that might be in one single lymphatic territory, or two or three, or the whole arm or the whole leg, depending on where it's occurring. And just to remember, here's our key message. This is the most important thing. Our aim as a patient or a carer or a supporter of a person with lymphedema or a therapist is to, number one, get the lymph load down. You might improve skincare, or getting the transport capacity up. You might develop more lymphatic pathways, open up anastomoses, create new anastomoses surgically or whatever. But that's the whole principle of it. And just have one last look at this diagram, and I hope you understand it, and I hope it explains to you why not everyone gets lymphedema and what we can do to minimize its problem. Now, please have a look at this picture. Look how close our lymphatics and our veins are to each other. See this white one down in the middle here? That's a vein, a small saphenous vein in this case. There's our lymphatic vessels on either side of it. They've been enhanced by injecting some materials in them, but look how close they are. So what I want you to understand by that is that whenever something's going wrong with our blood vessels, it may impact on our lymphatic vessels. And likewise, treatment of our veins sometimes can affect our lymphatic vessel function. And we could talk about that a little bit later. In fact, why not talk about it now? Let's have a look. Proximity to veins, what does it mean? Well, it means a carryover of diseases or disorders or damage from the vascular system to the lymphatic system can occur. And some of these might be phlebitis in the vascular system, which can lead to lymphadenitis or lymphangiodenditis. Fragility, which means more molecules have to be taken up by the lymphatic system. There might be thrombi in our veins, which will block the nearby lymphatics because of the external pressure. There might have been stripping of our veins, which might have resulted in accidental damage to our lymph vessels near those veins and stop their functioning. There might have been accidental ligation of lymph collectors, which are near the veins that were ligated. And there may be accidental leakage of sclerotherapy agents into the lymphatics, which compromises them. So it's all saying we do have to be careful when we're having a vascular intervention about potential damage to our lymphatic system. Of course, lymph vessels also can be damaged when veins are harvested. Sometimes they may be accidentally damaged and cause a bit of a problem at the harvest site. But again, others in this talk, others today may be talking about those things. Now, I guess one of the things that we always believe is important here, and this is our president of the Lymphoedema Association of South Australia, which is Monique Barham, who's just recently won a local hero award of the Australian Heroes, and we're so proud of her because of that. But I want to emphasize assessing risk is important. We must all know what our risk factors are and see if we can minimize them. And assessing risk is important not only for those who don't have lymphedema, but those who are worried about getting it, and those who have got lymphedema. But it's important because it means here, look at this, we can all be proactive. Super, super important for us. And here's a risk assessment form for the arms. You've probably seen that in the Canadian Journal Pathways, but it's been modified and used in other places around the world as well. It just gives us a tick. It gives you an ability to tick a box to see what your risk factors might be. And once you've ticked a box and you know you've got a risk factor, you may be able to do something with them in terms of a concert with your health professional or other health provider. Here's another one for the legs, okay? The same thing applies. Knowing what the risk factors might be may allow you to modify them, to reduce the risk of you getting lymphedema. Super important to do, and I'm sure lots of others will be talking about that as well. Let's just have a look at some of the most important risk factors. Skin quality. We can all take better care of our skin. Blood pressure. If it's too high, get your GP to manage it. That'll reduce the load on our lymphatic system. Strength of our small blood vessels, like I said. It's particularly important in lymphedema or lipodemas. If they're a bit weak, talk to your health professional about making them stronger. There's plenty of ways of doing that. If we've got an infection of a cut or a wound or a scratch, treat it early. Get the appropriate management going so it doesn't spread. Get your weight managed. As you may have seen from Mei Fu's work and lots of other people around the world, weight, being obese or overweight, is one of the prime risk factors contributing to lymph load, which may precipitate lymphedema or make it worse. The other risk factor is fats, particularly long-chain fats in your diet. There's also some risk factors there about pro-inflammatory versus anti-inflammatory diets, and people like Karen Herbst and the rest can talk about those sort of things. And I guess the last one, as I mentioned earlier, because of proximity arrangements, if the vascular system, if our blood vessels are not working properly, it may impact on our lymphatic vessels. But what I want you to know is that knowing these risk factors allows you to modify or control them. That's super important. Now, I don't want to bore you about all our diagnostic criteria, but there are a whole pile of things we can use to actually work out how much fluid is in the tissues. We can use bioimpedance spectroscopy with SOZO, with in-body, and all sorts of other machines. We can use tissue dielectric constants with moisture meters and the like. We can use tonometry, indurometry to look at fiber in the tissue, or fibrinometry. And we can also use porometry and circumference and volume calculations to look at the size of the limb. But, you know, these are clinic-based and you don't always have access to them. But, you know, there are other strategies. There are these sort of things available, telehealth, LymphoTrack apps, and that used around the world. This is just one example of them. I don't derive any benefit or anything from these, but I think these apps can be useful to help you in your own home, especially if you're rural or remote. There's also an Australian-based program, and I'm sure you've got them in Canada as well, okay, which gives you the ability to learn online about what's going on. And that's where you see Monique and I and many others have participated in Australia. Now, let's have a look at things you can do, get involved with, and see how things are going, as well as your therapist, of course. One of them is called the stemmer sign. A positive stemmer sign is I can't pick up a fold of skin here in my nail, my fingers, or I can't pick it up here. A positive stemmer sign means you've got excess fibrosis in that area, and you can use it in any lymphatic territory to see how it is. It's a nice, simple sign you can use to test and see how things are going at home. But talk to your therapist about its use and get a feeling of how you can actually use it at home. Super important. Now, the other thing we can do to assess fluids in the tissue is something called a pitting test. So what you do here is you press your thumb into an area where you think there is some swelling for about 30 seconds or more. And if it leaves a little indent like you see here, then you know there's fluids present. And it may be time, if you've seen fluids for the first time in a given part of your body, to go and talk to your therapist or your health professional about them. But nevertheless, you can see how things are progressing by doing this just at home. So the pitting test and the stemmer sign are two things you can do at home, but talk to your therapist about them first. Now, you're going to be learning a lot of exciting things about treatment and management. And, you know, we've got compression, bandages, garments, and wraps. And I've got to say, I'm developing more enthusiasm for wraps. Why? Because that gives you more ability to control the pressure and the pressure gradients at home through your use, as long as you're aware of what we need to be achieving. There's also some increasing use of negative pressure. It's a little bit like suction. It lifts up the tissue and creates a negative pressure. And you might have seen some examples of that with lymph taping, for instance, and with PhysioTouch and other devices. There's also a range of lymphatic drainage techniques with all the groups who'll be presenting here, I'm sure, about their lymphatic drainage techniques. The other thing we can do in terms of helping our lymphatic system, managing it, is by activity, exercise, and breathing. And these two, exercise and activity, may be with a garment on. The other thing is diet. Think about your diet. Think about how you can make your diet less inflammatory, because lymphedema is basically an inflammatory condition. And if we've got a diet which is pro-inflammatory, it may be worsening things, okay? So we'll just think about what you can do for diet. What that means is you need to seek advice from a dietitian or a nutritionist. Weight management, important. And the other important management area, even in cold environments, because all our pools are nicely warmed up in winter, is water-based programs, because that gives you external compression. Really great programs. I won't talk about those because I'm sure others are going to. Now, let's just have a look at what we do when we compress something. So here's a picture of what's going to happen when we compress. You imagine this is a wrap or a garment or a bandage or external pressure we're putting on the tissues. See how we're pushing out the fluids and all these little proteins in the tissue, and they're going somewhere. Where are they going? Well, we hope they're going into the lymphatics, and we hope they're going proximally. In other words, we hope they're going to an area where we've already emptied out. But sometimes it may not go that way. It might go what's called distally, or in the reverse direction. So I might put some pressure on here, and the flow goes back to my hands and my fingers. That's bad. We have to avoid that. So we have to make sure that when we apply pressure, like you just saw there, that we apply the pressure in a way that it is appropriate pressure and that we've got the right pressure gradient, and we're pushing the fluids and their contents out proximally to a place we've emptied out already. Okay, simple actions I emphasize can really help lymph flow. Deeper breathing, isotonic, isometric muscle movement, and what I mean there is I'm just moving now. I'm moving my lymph and my waste products from the tissues, and I can sit absolutely still, and I can just tighten my muscles while I'm sitting still. That's doing the same sort of thing, helping my lymph flow. I can leg paddle. I can do all sorts of things. If I can't move because I've got some muscular problems, then you can stimulate the muscles electrically and get the same outcome. But what I want you to do is always remember this simple action is emptying the buckets. Do this, empty the buckets before donning or doffing a garment or a wrap. Empty the buckets before you do any exercise, before you do any massage, because then the lymph and the products that you're moving have got a place to go. And what I want you to also think about, and you can ask questions of others in the meetings later on today, just try and look at minimizing your tummy lymph loads by having a diet which is not high in large long chain fats which have to be absorbed into the lymphatic system. Okay, so particularly ensure there's you haven't had a big meal just before you're going to bed, which is rich in fats, because that's going to load the lymphatic system in your tummy, and that means it may be hard for the lymph to leave your legs, for instance. So think about this. Big picture here is going to make a big difference. And that's what I mentioned before, breathing. Just breathe, Tai Chi, Qigong sort of breathing, 5 times a day, we reckon is pretty good. Talk to your therapist about whether that's appropriate for you or not. It makes a difference. I'm always very much in favour of aquatherapy, and in Australia, I guess we're a little bit warmer than you and we can get into the cold water. But, you know, it's really important because when you're in water, it can help vary the tissue pressures. Is a greater external compression. The deeper you are in the water, the higher the compression. It supports our body and tissues, which is really great if you have mobility problems on land. And when we're in water moving around, we have got a variation in pressure as we move. And that is really important. Pressure variation as we move. So again, that pressure variation as we move our arms forward and back, or our legs forward and back, can help our lymph flow at a given part in our body. Super important, aquatherapy. Now, let's just have a look at what happens when our muscles move. Here it is. You see here, what I'm doing, I'm moving my hands. That's what this is doing. That's helping the lymph flow along these little lymph vessels here. These little nodules that you see here are the functional and structural units of our lymphatic system called lymphangions. And I'll just show that to you again. Here it is. When I'm moving, that's what's happening to the tissues. If a therapist's hand is moving over your tissues, that's what is happening, okay? If you are doing some self-massage, that's what is happening. Now, if you can hear some strange noise in the background, I'm up in the top of a hill at the moment at home, and that is a thunderstorm running through. Now, I want you to also remember that some situations may slow lymph flow. Bloating in the tummy, constipation, fat in the tummy area, and shallow breathing can all slow lymph flow or make it difficult for us, as might examples of constant external pressure in the wrong place. Look here on the shoulder, look here on the side. Think about underwear, for instance. Have a look at your underwear tonight when you go home, not now, but tonight when you go home, and see if there's wrong pressure, constant external pressure in the wrong place that might be interfering with lymphatic drainage. Very important to remember and think about. I want to emphasize normal lymph flow is very slow, very minimal. And, you know, about 5 mils per hour from our arms and about 20 mils per hour from our legs. You know, that's not much. And I want you to remember, please, that it doesn't take too much effort to make changes to these flows. Small changes in what we do can make a big difference to our lymph flow. An infection can double our lymph flow to 10 mils per hour, or up here to 40 mils per hour. But then again, if we facilitate good drainage, we can get it to move away really quickly and efficiently and effectively. Small things make a big difference to our lymphatic system. You don't have to do too much to make a difference, but you can do it. Important points, I think I want to emphasize these again and again. Important points to help you live life well with your lymphedema. In the maintenance phase, when your therapist has stopped doing the intensive phase, you take more control. Remember, it's always in a partnership, and explore the treatment options and ask and see what's likely to work from you. Please check everything and see what's best for you. Please also know what you want. Is it a reduction in size, an improvement in how the limb feels, better ability to undertake activities of life, you know, maybe hang up the clothes or the washing or do something with your kids? Is it improved functionality? And we sometimes forget about these things, super important. Also, know what you will be able to do, that is, and know what you can't do, okay? Know what you're capable of, and please, I always urge everyone, do only one thing different at a time. Then you know what really works, okay? Saves you doing a plethora, a whole variety of things, some of which may not be working for you. It's called an RCT of 1 in the scientific circles. And I urge you, if there's any equipment out there, try before you buy, rent before you buy it, and see if that works for you. That's really important for you. Key messages of my talk today are, number 1, ask for early identification of changes which have occurred in your limb or part of body. Request early intervention, and it's always best to have targeted and sequenced treatment, okay? Just because you've got a swollen leg or a swollen arm, You can't always go in and just do massage. You may have to use some laser or LED to break up the fibrous tissue. Know your role and how your partner and carer or others can help you. Seek independence for your management. You can do a lot of things yourself if you want to. And think, assess, treat, and manage holistically. That's the most important message of my whole talk today. Do it holistically. Please remember, early advice, even over the phone, can reduce the lymphedema risk. Early signs of lymphedema and lymphoedema can be detected by practitioners and by you. Early intervention can reduce the severity of your lymphedema or your lymphoedema, slow its progression, and reduce healthcare system and your costs. Super important. And I guess early intervention will give you confidence and control back to you. And that's what's really important. And please always seek information from good websites. And the Australian, the British, the Canadian, the National Lymphoedema ones are the ones that are most important. There's a lot of questionable material out there on the internet. Please use it only from good websites and talk to your health professional and perform everything as part of a partnership. Be holistic in a partnership and really make sure that we're considering all parts of the lymphatic system. You're considering the lymphatic system as a total system of the body. Think holistically, because just because you've got a swelling in the legs doesn't mean that's where the problem is. It might be here in the groin, the tummy, the chest, or even your left shoulder. Okay, work in a partnership. Thank you for watching and listening. I hope it can help make a difference for you. So my best wishes for the rest of the talk today. Thank you very much.